Mental health is essential for overall well-being. It affects how we think, feel, and act. It also impacts how we handle stress, relate to others, and make choices. In recent years, there's been a growing awareness of mental health issues. More people are talking openly about their struggles. However, there's still a long way to go. One of the biggest challenges in addressing the mental health crisis is overcoming stigma. Stigma refers to negative attitudes, beliefs, and behaviors towards individuals with mental health conditions. It can prevent individuals from seeking help, disclosing their conditions to others, and living full and meaningful lives. Stigma can manifest in many ways. It can be subtle, like avoiding someone with a mental illness, or overt, like using derogatory language. It can also be systemic, embedded in policies and practices that discriminate against those with mental health conditions. The consequences of stigma are significant. It can lead to shame, isolation, and discrimination. It can also prevent individuals from accessing employment, education, and social support. The fear of being stigmatized can also deter individuals from seeking professional help, leading to worsening symptoms and reduced quality of life. Breaking down stigma requires a multifaceted approach. It involves challenging negative stereotypes, promoting accurate information about mental health, and encouraging open conversations. It also requires creating supportive environments where individuals feel comfortable disclosing their conditions and seeking help without fear of judgment. Mental health is not just the absence of mental illness. It's a state of well-being in which an individual realizes their own abilities, can cope with the normal stresses of life, can work productively and fruitfully, and is able to make a contribution to their community. Just like physical health, mental health exists on a spectrum. There are times when our mental health is good and times when it's not so good. Life is full of ups and downs, and it's normal to experience a range of emotions. However, when these difficult emotions persist, are intense, or interfere with our daily lives, it may be a sign of a mental health condition. Dr. Patel. Media, doctor talking to a patient, empathetic conversation between two people. Dr. Patel speaking to the camera. Mental health conditions are not a sign of weakness or a character flaw. They are real, treatable medical conditions that can affect anyone. Just as we wouldn't hesitate to seek help for a physical health problem, we shouldn't hesitate to seek help for a mental health concern. Dr. Patel. Media, Dr. Patel explaining symptoms, mental health awareness seminar, informative session about mental health. Understanding the signs and symptoms of mental health conditions is crucial for early identification and intervention. Some common signs include changes in mood, sleep, appetite, energy levels, concentration, and social withdrawal. If you or someone you know is struggling, it's important to reach out for help. Mental health disorders encompass a wide range of conditions that affect mood, thinking, and behavior. These disorders can manifest in various ways and impact individuals differently. Some common types of mental health disorders include anxiety disorders, mood disorders, psychotic disorders, and personality disorders. Anxiety disorders are characterized by excessive fear, worry, and anxiety. These feelings can be persistent and overwhelming, interfering with daily life. Examples of anxiety disorders include generalized anxiety disorder, panic disorder, social anxiety disorder, and phobias. Mood disorders, also known as affective disorders, are characterized by significant disturbances in mood. These disturbances can manifest as periods of extreme sadness, known as depression, or extreme elation, known as mania. Examples of mood disorders include major depressive disorder, bipolar disorder, and persistent depressive disorder, also known as dysthymia. Psychotic disorders are characterized by a disconnection from reality. Individuals with psychotic disorders may experience hallucinations, which involve seeing or hearing things that aren't there, or delusions, which involve holding false beliefs that are not based in reality. Schizophrenia is a common type of psychotic disorder. Section 2. Anxiety, the overwhelming worry. Anxiety is a normal human emotion that everyone experiences from time to time. It's a natural response to stress or danger, helping us stay alert and aware of potential threats. However, when anxiety becomes excessive, persistent, and interferes with daily life, it may be a sign of an anxiety disorder. Maria Generalized Anxiety Disorder, or GAD, is characterized by excessive worry and anxiety about a variety of things, such as work, school, health, finances, or relationships. Individuals with GAD often find it difficult to control their worry, and they may experience physical symptoms such as muscle tension, fatigue, restlessness, difficulty concentrating, irritability, and sleep problems. Panic disorder is characterized by recurrent and unexpected panic attacks, which are sudden episodes of intense fear that peak within minutes. Panic attacks can involve physical symptoms such as a racing heart, sweating, trembling, shortness of breath, chest pain, dizziness, nausea, and a fear of dying or losing control. Maria social anxiety disorder, also known as social phobia, is characterized by intense fear or anxiety about social situations where the individual may be scrutinized or judged by others. Individuals with SAD may fear public speaking, meeting new people, eating in front of others, or attending social gatherings. Section 3. Depression, the persistent sadness. Depression is more than just feeling sad or blue. It's a serious mental health disorder that can have a profound impact on an individual's thoughts, feelings, behavior, and physical health. Depression is characterized by persistent sadness, loss of interest or pleasure in activities, and a range of other emotional, cognitive, and physical symptoms. Sarah, major depressive disorder or MDD, is characterized by persistent depressed mood or loss of interest or pleasure in activities for at least 2 weeks, along with other symptoms such as changes in appetite or weight, sleep disturbances, fatigue, feelings of worthlessness or guilt, difficulty concentrating, and thoughts of death or suicide. Persistent depressive disorder, or dysthymia, is a chronic form of depression that lasts for at least 2 years. Individuals with dysthymia may experience less severe symptoms than those with MDD, but their symptoms are more persistent and can significantly interfere with their daily lives. Sarah bipolar disorder, previously known as manic depression, is characterized by extreme mood swings between episodes of mania or hypomania and episodes of depression. Mania is characterized by elevated or irritable mood, increased energy, racing thoughts, impulsivity, and a decreased need for sleep. The depressive episodes in bipolar disorder are similar to those experienced in MDD. Section 1. The personal cost of mental illness. Mental health disorders take a heavy toll on individuals, affecting various aspects of their lives. The impact can be profound and long-lasting, leading to a diminished quality of life and a sense of hopelessness. It's crucial to recognize the personal struggles individuals face as they navigate the challenges of mental illness. Living with a mental health disorder can be incredibly isolating. Individuals may feel like they are carrying a heavy burden, unable to share their struggles with others for fear of judgment or rejection. This sense of isolation can be compounded by the stigma surrounding mental illness, making it even harder to reach out for support. Mental illness can also significantly impact an individual's ability to function in daily life. Simple tasks that were once manageable can feel overwhelming and insurmountable. This can lead to a decline in work or school performance, difficulty maintaining relationships, and a sense of overall dysfunction. The emotional pain associated with mental illness should not be underestimated. Individuals may experience intense feelings of sadness, anxiety, fear, guilt, shame, or worthlessness. These emotions can be all-consuming, making it difficult to find joy or hope in life. Social isolation and broken relationships are common consequences of mental health disorders. These disorders often create barriers to social connection, leading to isolation and strained relationships. The symptoms of mental illness, such as social anxiety, withdrawal, and difficulty regulating emotions, can make it challenging to form and maintain healthy connections. Individuals struggling with mental health issues may withdraw from social situations, fearing judgment or feeling overwhelmed. They may avoid social gatherings, isolate themselves from loved ones, and struggle to maintain friendships. This social isolation can exacerbate feelings of loneliness and despair. Mental illness can also put a strain on existing relationships. Family members and friends may struggle to understand the individual's experiences, leading to frustration, resentment, and a breakdown in communication. The individual's behavior, influenced by their mental health condition, may create conflict and tension within relationships. The stigma surrounding mental illness can also prevent individuals from seeking support from loved ones. They may fear being judged, misunderstood, or seen as weak or flawed. This fear of stigma can lead to further isolation and a reluctance to engage in open and honest conversations about their struggles. The economic impact of mental health disorders is significant, affecting individuals, families, and society as a whole. Untreated mental illness can lead to decreased productivity, unemployment, and increased healthcare costs. Individuals struggling with mental health issues may experience difficulty concentrating, making decisions, and meeting deadlines. This can lead to decreased productivity at work or school, potentially resulting in job loss or academic struggles. The cost of treating mental illness can be substantial, including therapy sessions, medication, and hospitalization. Individuals without access to affordable healthcare may delay or forego treatment, leading to worsening symptoms and increased costs in the long run. Untreated mental illness also has a ripple effect on the economy. The World Health Organization estimates that depression and anxiety alone cost the global economy $1 trillion each year in lost productivity. This highlights the importance of investing in mental health services and support systems. Mental illness doesn't just affect the individual, it impacts families, friends, and communities as a whole. The emotional, financial, and social burdens of mental illness can ripple outward, creating challenges for everyone involved. Family members often take on the role of caregiver for loved ones with mental illness. This can involve providing emotional support, managing medications, and navigating the healthcare system. The demands of caregiving can be physically and emotionally draining, impacting the caregiver's own well-being. Children growing up in households affected by mental illness may face unique challenges. They may witness their parents' struggles, experience disruptions in family life, and feel a sense of responsibility for their parents' well-being. These experiences can have long-term impacts on their own mental health and development. Communities also feel the impact of mental illness. Untreated mental health issues can contribute to homelessness, substance abuse, and crime. Creating supportive communities that prioritize mental well-being is essential for addressing these challenges and fostering a sense of belonging for everyone. The COVID-19 pandemic has had a profound and far-reaching impact on mental health globally. The unprecedented challenges posed by the pandemic, including lockdowns, social isolation, economic uncertainty, and fear of illness, have taken a significant toll on individuals' well-being. The pandemic has created a breeding ground for anxiety and stress. The constant fear of contracting the virus, the disruption of daily routines, and the uncertainty about the future have left many people feeling anxious, overwhelmed, and on edge. Social isolation, a necessary measure to curb the spread of the virus, has also had detrimental effects on mental health. Humans are social creatures, and prolonged periods of isolation can lead to feelings of loneliness, boredom, and depression. The lack of social interaction can disrupt our sense of belonging and purpose, further impacting our mental well-being. The economic fallout from the pandemic has also contributed to the mental health crisis. Job losses, financial insecurity, and the strain on healthcare systems have exacerbated existing mental health conditions and created new challenges for individuals and families struggling to cope. While the pandemic has affected everyone's mental health to some extent, it has disproportionately impacted individuals and communities already facing systemic barriers and inequalities. Marginalized groups, including people of color, low-income communities, and essential workers, have borne the brunt of the pandemic's mental health consequences. People of color have been disproportionately affected by the virus itself, experiencing higher rates of infection, hospitalization, and death. This, coupled with the ongoing fight for racial justice and the traumatic experiences of discrimination, has created a perfect storm for mental health challenges. Low-income communities, already grappling with poverty, unemployment, and limited access to healthcare, have faced even greater challenges during the pandemic. The economic downturn has exacerbated financial insecurity, leading to increased stress, anxiety, and despair. Essential workers who have risked their lives on the front lines of the pandemic have also experienced significant mental health strain. The constant exposure to the virus, long working hours, and emotional toll of caring for sick and dying patients have left many essential workers feeling burnt out, traumatized, and emotionally exhausted. The COVID-19 pandemic has exposed the fragility of our mental health systems and highlighted the urgent need for increased investment in mental health services and support. The pandemic's long-term mental health consequences are still unfolding, and it's crucial to act now to mitigate the damage and build more resilient communities. Governments and healthcare providers need to prioritize mental health in their pandemic recovery plans. This includes increasing funding for mental health services, expanding access to affordable care, and addressing the unique needs of marginalized communities. It's also essential to address the root causes of mental health disparities, such as poverty, discrimination, and lack of access to education and employment opportunities. Creating a more equitable and just society is crucial for promoting mental well-being for all. The pandemic has also highlighted the importance of community support and resilience. We need to foster a culture of care and compassion where individuals feel comfortable seeking help and supporting one another through challenging times. By working together, we can build a world where mental health is valued, prioritized, and accessible to all. Public education campaigns can play a significant role in demystifying mental health issues and encouraging more people to seek help. One successful example is the Time to Change initiative in the UK. This campaign has focused on changing attitudes towards mental health through a combination of media campaigns, social media outreach, and community events. Anna, by sharing personal stories and providing factual information, Time to Change has helped to reduce stigma and promote open conversations about mental health. Educational institutions also play a critical role in raising awareness. Schools and universities can incorporate mental health education into their curricula, teaching students about the importance of mental well-being, recognizing signs of mental health issues, and knowing how to seek help. This early intervention can equip young people with the knowledge and tools they need to manage their mental health throughout their lives. ANA workplaces are another important setting for raising awareness. Employers can provide mental health training for managers and staff, create supportive policies, and promote a culture of openness and support. Programs that focus on mental health awareness can help reduce stigma, encourage employees to seek help, and improve overall workplace well-being. Access to mental health care is a significant barrier for many individuals. Improving access involves expanding services, increasing the availability of mental health professionals, and integrating mental health care into primary healthcare settings. These efforts are essential to ensure that everyone who needs help can receive it. One promising approach is the expansion of telehealth services. The COVID-19 pandemic accelerated the adoption of telehealth, making it a viable option for delivering mental health care. Telehealth can bridge the gap in access, particularly in underserved areas where mental health professionals are scarce. By providing remote consultations, therapy sessions, and follow-up care, telehealth can make mental health services more accessible to a broader population. Increasing the number of mental health professionals is another crucial step. This can be achieved through targeted training programs, incentives for working in underserved areas, and policies that support the recruitment and retention of mental health workers. By addressing the shortage of professionals, we can ensure that more people have access to the care they need. Integrating mental health care into primary healthcare settings is also essential. This approach allows for early identification and intervention, as primary care providers can screen for mental health conditions during routine visits. Integrated care models, where mental health professionals work alongside primary care providers, can improve coordination and continuity of care, leading to better outcomes for patients. Cognitive behavioral therapy, or CBT, is one of the most widely used and effective treatments for conditions such as depression and anxiety. CBT focuses on identifying and changing negative thought patterns and behaviors, helping individuals develop healthier ways of thinking and coping. By working with a trained therapist, individuals can learn practical strategies to manage their symptoms and improve their mental health. Dr. Patel. Medications also play a vital role in the treatment of mental health disorders. Selective serotonin reuptake inhibitors, or SSRIs, for example, are commonly prescribed for depression and anxiety. These medications can help balance chemicals in the brain that affect mood and emotions. It's essential that medications are prescribed and monitored by a healthcare professional to ensure their effectiveness and manage any side effects. Another important aspect of evidence-based treatment is personalization. Mental health conditions and their symptoms can vary widely from person to person, so treatment plans should be tailored to the individual's unique needs and circumstances. This personalized approach can include a combination of therapy, medication, lifestyle changes, and support from family and peers, ensuring comprehensive care. Community support plays a vital role in promoting mental well-being and supporting individuals with mental health conditions. It provides a sense of belonging, reduces isolation, and offers a platform for sharing experiences and accessing resources. Strong communities can act as a buffer against the challenges of mental illness and foster a culture of understanding and empathy. John support groups offer a safe and confidential space for individuals with mental health conditions to connect with others who understand their experiences. These groups provide a platform for sharing stories, coping strategies, and words of encouragement. The peer-to-peer support offered in these groups can be incredibly empowering, reminding individuals that they are not alone in their struggles. Community-based organizations play a crucial role in providing mental health services and advocating for the needs of individuals with mental health conditions. These organizations offer a wide range of programs and services, including support groups, educational workshops, advocacy initiatives, and resources for navigating the mental health system. John, creating mental health-friendly communities requires a collective effort. It involves promoting inclusivity, challenging stigma, and fostering a sense of belonging for everyone. By working together, we can create communities where individuals with mental health conditions feel supported, valued, and empowered to live full and meaningful lives. Policy change is essential for creating a society that prioritizes mental health and provides adequate support for individuals with mental health conditions. Advocacy efforts aim to influence government policy, funding allocations, and legislation to improve mental health services and address systemic barriers to care. And one crucial aspect of advocacy is advocating for mental health parity. Mental health parity refers to the equal treatment of mental health conditions and physical health conditions in insurance plans. This means that individuals with mental health conditions should have access to the same level of coverage for their treatment as they would for a physical health condition. Advocacy efforts also focus on increasing funding for mental health research, prevention programs, and treatment services. Adequate funding is crucial for developing new treatments, expanding access to care, and supporting the development of innovative mental health initiatives. Policy change can also address the social determinants of mental health, such as poverty, discrimination, and lack of access to education and employment opportunities. By creating more equitable and just societies, we can reduce the prevalence of mental health conditions and promote overall well-being. Addressing the mental health crisis requires a collective effort, bringing together individuals, communities, organizations, and policymakers. Building a movement for mental health involves raising awareness, challenging stigma, advocating for policy change, and promoting mental well-being in all aspects of society. Social media has become a powerful tool for raising awareness about mental health and connecting individuals with resources and support. Online campaigns, hashtags, and personal stories shared on social media platforms help to break down stigma and encourage open conversations about mental health. Celebrities and public figures play a crucial role in raising awareness by sharing their own experiences with mental health conditions. Anna, their openness and vulnerability help to normalize mental health challenges and encourage others to seek help without shame or fear of judgment. Building a movement for mental health requires sustained effort, collaboration, and a shared commitment to creating a world where everyone has the opportunity to thrive. Anna, by working together, we can break down barriers, promote understanding, and ensure that mental health is valued, prioritized, and accessible to all. The mental health crisis is a complex and multifaceted issue that demands our attention and action. It's not someone else's problem, it's a shared responsibility that requires a collective effort from individuals, communities, and policymakers alike. By acknowledging the profound impact of mental health on our lives and the lives of those around us, we can begin to dismantle the stigma and create a more supportive and inclusive society. John, each of us has a role to play in promoting mental well-being. We can start by educating ourselves about mental health conditions, challenging our own biases and stereotypes, and creating safe spaces for open and honest conversations. Small acts of kindness and understanding can make a world of difference in the lives of individuals struggling with mental health challenges. We must also hold our leaders accountable for prioritizing mental health in policy decisions and resource allocation. Adequate funding for mental health services, research and prevention programs is essential for addressing the growing need for care and supporting the development of innovative solutions. John. By working together, we can create a world where mental health is valued, prioritized, and accessible to all. This means investing in prevention programs that promote mental well-being from an early age, expanding access to affordable and culturally competent mental health care, and creating supportive communities that foster a sense of belonging and connection. While the challenges of mental illness are real and significant, there is always hope for healing and recovery. With the right support, treatment, and resources, individuals with mental health conditions can live full and meaningful lives. It's essential to remember that mental illness is not a life sentence. It's a chapter in a person's story, not the whole story. Advances in mental health research continue to shed light on the complexities of the brain and lead to the development of new and more effective treatments. From innovative therapies like transcranial magnetic stimulation, or TMS, to the growing field of pharmacogenomics, which tailors medication choices based on an individual's genetic makeup, the future of mental health care is filled with promise. Beyond traditional treatments, there is a growing recognition of the importance of holistic approaches to mental well-being. Practices like mindfulness, meditation, yoga, and spending time in nature have been shown to have positive impacts on mental health and can complement traditional treatments. Investing in hope and healing means not only supporting research and innovation, but also creating a culture that embraces mental health as an integral part of overall well-being. This includes promoting mental health literacy, reducing stigma, and fostering a sense of compassion and understanding for those who are struggling. The journey towards a brighter future for mental health requires a shift in perspective, a commitment to action, and a belief in the power of human resilience. It's time to move beyond the silence, shame, and stigma that have surrounded mental health for far too long and embrace a future where everyone has the opportunity to thrive. Imagine a world where mental health is treated with the same urgency and importance as physical health, where seeking help is seen as a sign of strength, and where individuals with mental health conditions are met with compassion, understanding, and support, not judgment or discrimination. This is the future we must strive to create. A future where mental health is no longer a taboo subject, but a shared priority. A future where everyone feels empowered to seek help when they need it, and a future where individuals with mental health conditions can live their lives to the fullest potential. Let us move forward with hope, determination, and a shared commitment to creating a world where mental health matters, where everyone feels seen, heard, and supported, and where the light of hope shines brightly on the path towards healing and recovery.